Hi, this is a group 5 and we are in the PPN course, and this is our project on how the COVID-19 pandemic has affected the opioid crisis in North America. My name is Georgia and I'm doing health related concerns.
Hello, my name is Grace and I'm doing connection to mental health.
Hi, my name is Samaya and I'm doing cultural consideration.
Hi, my name is Michaela and I'm also doing cultural consideration.
Hi, my name's Natalie and I'm doing philosophical approach.
Hi, my name is Janine and I'll be doing nursing implications.
Health concerns for the opioid crisis. Our young adults are dying at the cost of Big Pharma. In the last year, over 81,000 young adults have died in America due to the opioid overdose. This is the highest recorded opioid death toll in history, with opioid deaths in the West Coast states having increased by 98% and in the central and eastern states having increased by at least 50% during the COVID-19 pandemic. This is a serious health concern that's only getting worse. The opioid crisis started in the late 90s, but has significantly peaked in the last few years. Young adults during this time have tremendously suffered throughout the economic recession with virtual education, social isolation, and a drought of job opportunities, which has only increased stress and mental health issues. During this pandemic, most youth were not able to seek the help that they needed, causing more vulnerability than ever seen before. As stated by John Oliver in his reporting on the ongoing opioid crisis, pharmaceutical companies such as McKesson and Purdue prey on the vulnerable. Richard Sackler, the president of Purdue Pharma, the makers of OxyContin, bragged about the addictiveness of his new product, OxyContin, during its release to the public. It will be a blizzard of prescriptions that will bury the competition. Big pharma companies such as McKesson and Purdue make over $3 billion a year, with OxyContin racking in over $35 billion a year for Purdue in the last decade. Researchers suggest that OxyContin has fueled the opioid crisis. However, Richard Sackler denies these claims, blaming those who are addicted to the drug he created, saying, "We have to hammer down on the abusers in every possible way. They are the culprits and they are the problem. They are reckless criminals." Unfortunately, with these big pharma companies dominating the market, they aren't being able to be held accountable for their unethical actions due to the being able to pay off fines. Most recently, Purdue Pharma pled guilty to felony charges for defrauding regulars and paying illegal kickbacks to doctors.
OxyContin.
With this lack of oversight and unlimited funding, in conjunction with the rapid incline of mental health issues, this public health crisis is only going to get far worse fast, but will also kill thousands more of struggling young adults across Canada and the United States who only deserve better.
Mental health is inevitable for this topic. In the peer-reviewed articles, it states that the COVID-19 pandemic is a parallel mental health epidemic in North America. Byproducts of the pandemic, such as lockdown, closure of stores, stay-at-home orders, cause boredom and stress. However, it is stated in the article that the stress and the boredom caused by the COVID-19 pandemic are the rationals for the risk-taking behavior of intaking opioid for young adults. One of the claims of this article was that since face-to-face interactions has very much decreased due to the pandemic, it was hypothetically expected that there will be also a decrease in opioid access and usage among young adults. However, since young adults seek for emotional support caused by COVID pandemic through social media and they are very susceptible to it, social media has become an alternative source for opioid access.
Although opioid addiction can be viewed as the user having bad character and it being within their control, it can also be seen as a disease, an addiction that the user has no control over or responsibility for. The article examines what people who aren't opioid users, the participants, view as a distinguishing point between a person with bad character who uses opioids versus a person who needs help, someone addicted to opioids, and how all of this connects back to the intersection of race, social class, and gender. The study conducted in the article showed participants different vignettes of varied races, gender, working class, ages, and histories. Not a lot of accurate information on the content of the study can be used, since the study was biased and many of the participants were white, but we can assume that people of the same race as the opioid user vignette they were shown would be harder to judge those that shared the same race as them. Another result that can be pulled from the study is that participants showed a lot more empathy and understanding towards the vignettes whose histories were sad, and it seemed like they had a reason to start using opioids. The participants of the study deemed these vignettes as people who had an addiction and needed help, whereas the participants lacked empathy for the vignettes whose histories weren't bad or sad, meaning they came from good homes and families. The participants believed these vignettes had no reason to start using opioids and thus showed them no empathy and viewed them as bad people.
How opioid users are perceived in the public eye is greatly influenced by race, social status, and gender. The survey in the article showed that the white students were harder on their own race and less biased towards other races because they did not want to come off as being racist. This impacted the result for other races using opioids, as their ultimate results were evaluated more positively. In terms of the working class, the results showed that the poor people were negatively evaluated compared to the middle class or upper class. This is due to the participants being biased towards the middle and upper class. For gender, the opioid is targeted to the male population more often rather than the female population, as the study indicates that majority of female use opioids for health reasons. Throughout the study, the participants rated different aspects differently. For instance, higher class participants evaluated opioid users more negatively, whereas lower class and middle class participants evaluated keeping in mind the stereotypes, negative feelings, social distance during COVID, and discrimination measures. The bias in evaluating portrays the strong effect the stereotype have on the participants to this day.
The pandemic has increased the use of opioids among younger citizens. John Oliver's HBO trilogy titled Opioids is a series consisting of the raging epidemic exacerbated by the pandemic, focusing on the pharmaceutical companies that develop and push opioids to hospitals, pharmacies, and the public. John Oliver demonstrates critical social theory, uncovering the power imbalance in between major pharmaceutical companies and the public, mainly focusing on Purdue Pharma and the controversies between the drug they developed, OxyContin, which is a brand name for oxycodone. In John's most recent video, he speaks about the heightened threat of oxycodone shaped by the pandemic and the way that pharmaceutical companies can slip through the rules and regulations. Through the series, he speaks on behalf of the victims, including young adults and teenagers who were prescribed medications that were extremely addictive and fatal, and the relationship these prescriptions had with the pharmaceutical companies. John Oliver's approach provides a framework of beneficial content regarding the main source of the opioid crisis by mentioning all the varying legal proceedings and shedding light on the people behind the crisis. However, it is missing the viewpoint of the pharmacies and the hospitals who are prescribing these medications and what they are led to believe. While the viewpoint of the victims is mentioned, it is not highlighted enough to obtain validity in the sense of understanding the level of oppression. To understand who is affected by the opioid crisis, one must have a background knowledge of the effects of the crisis on the public before watching the series. While John Oliver's approach is geared toward American pharmaceutical companies and the opioid crisis, it is not limited towards it. North America is suffering from this epidemic of fatal opioid overdoses, and it's not something future nurses should ignore.
So the main nursing implication we can draw from our topic is that nurses need to educate themselves and the community around them on opioid addiction, especially during this time of the pandemic where stressors and triggers are amplified. So knowing the signs of addiction, recognizing financial and racial inequities, and knowing the importance of mental health are really important in creating a difference in the community as you're informing them on the signs to look out for and to consider in their youth. The synthesis of the new knowledge and nursing knowledge actually customizes really well into the nursing meta paradigm. So for example, with the section of person, you know now that addiction patients are really prone to mental health issues. So you really want to focus on making them feel respected as a person and really focusing on client-centered care. Relating to health and environment also helps show the impact of isolation and the decrease in social interaction. So that helps as well, and to know what to look out for. And then in nursing in general, in that section, you want to be an educator. So relating to what I had previously said, you're going to be an educator in the community, and you're also going to be a support system to them. And so not only just the patient, but also to the family and the community in their journey with addiction. So you want to help support them physically and mentally to help get them through this process.